It, it's really a great pleasure to welcome you all today for today's session with me Journal Club. The first session was entitled The Lecture Pre-Curriculum, Setting the Stage for Lifelong Learning, and it was produced or prepared by Dr. Anne-Breen Aziz. And actually, this is a highly relevant topic, especially for us as a health professional, where education continue to shift toward the more active learning-centered approaches. We are honored that this session to be held under the patronage of Professor Wagdi Talat, whose leadership is considered to be instrumental for advancing medical education across our region. So today's session will be brought together by two distinct colleagues who will enrich our discussion. First of all, it's my privilege to introduce Dr. Sana Iqbal, Assistant Professor in the Department of Medical Education, Rifa International University, Pakistan. And Dr. Sana is a valuable expertise in contemporary educational strategies, innovative curriculum design. And we also having Dr. Ahmed Al-Arabi, Administrator of Medical Education Department, Faculty of Medicine, Mansoura University. Ahmed represent emerging generation for the medical education who actually actively engaged in implementing modern educational practices in our faculty, because I'm head of the department for Ahmed. So together they will guide us toward critical reflection on how to move forward toward a lecture-free curriculum and prepare learning for these activities. So we are looking forward for a rich interactive discussion and encourage all participants to be engaged and share their perspective. Thank you all for joining us, and let's begin. Dr. Sana, the floor is yours. So you can start sharing your presentation now, and wish you a good presentation and a fruitful session. Thank you.
Hello, everyone. Thank you so much for your introduction. So I'm hopeful I'm audible to all of you. Kindly confirm this thing.
Yes, Dr. Sana. Kindly make the presentation and presenter view.
Okay. Okay, now it's fine. Okay. Just wait. Okay, hello everyone. Thank you so much for your introduction. I'm Dr. Sana Iqbal. I'm working as an assistant professor and head of department in dental education at Rifa International University. So today we're going to have an interesting session related to one of the theme provided by Egyptian Society for Medical Education, which is based on lecture-free curriculum, and we're going to talk about team-based learning. And I hope we're going to have an interactive and engaging session related to the importance of adopting TBL in health professional education. So the aim of this session is to give you the brief overview of TBL and guide the educators towards successful design and implementation of TBL within health professional education. So major agenda of this session revolves around the basic understanding of team-based learning and explaining the rationale behind adoption of TBL in health professional education, outlining the core structure of TBL, and then to discuss the key facilitation strategies required for the effective delivery of PBL, to discuss the basic benefits and challenges associated in the design and implementation of PBL. So before starting the main session related to TBL, I request all of you to kindly think for a moment. And I want to ask you this thing, that as educators, we all know that for decades, lectures have been the backbone of delivering the content in various disciplines and professions. We stand in front of students, deliver content, and expect learning to happen. In fact, it has become the most convenient and accepted way to deliver breadth of knowledge to large number of students at once. But have you ever thought for a moment and asked yourself this question, that are students actually learning what you want them to learn, or are they even listening and truly engaged with the content you have delivered through lecture? Because there is a growing disconnection between how we teach and how students learn, as traditional lecture-based approaches, though widely practices, do not fully reflect contemporary understandings of learning, where engagement and applications are central to clinical competencies. As you find in the literature and see the literature, you're going to find body of evidence which highlights certain challenges associated with traditional lecture-based system. And I'm pretty sure most of you, while delivering the lecture, have actually experienced those challenges. So any one of you can actually highlight the challenges which you have encountered while delivering the content to the students through traditional lecture system. What challenges basically you face while giving the content, delivering the content through lecture? Yes. Can anyone comment on this thing? What problems are associated with the traditional lecture-based system?
I'm Dr. Amreen Aziz. Actually, the students are not listening to the lecturer. They are not
Very good.
actively engaged.
They are not actively engaged. Very well. And this is what written in the literature as well. The passive lectures tend to reduce student engagement and satisfaction. Secondly, passive learning environments fail to develop high level of cognitive abilities of the students as they struggle to retain and apply that knowledge in the clinical context. Additionally, lectures follow one shoe fit for all model, which doesn't count and include different student learning preferences and styles, and in this way, it overall affect the academic performance of the students. So, based on these growing body of evidence, which has led to a global shift from lecture dominant curricula to what we call now lecture free curriculum. And this shift is not only based on evidence, it's also learner driven. You need to remember that. It is not only because of the evidence you're going to find in the literature, it's also because of the learners we are dealing today. And you all are familiar with this thing, that today we are dealing with Generation Z, who are digital natives, and you are familiar with this fact that their life being immersed in the technology has fundamentally reshaped their cognitive processes, which results in their preferences of learning to be interactive, engaging, collaborative, pragmatic, and relevant. And based on these findings, lectures are found to be insufficient for today's learners. Therefore, several medical schools have replaced lecture-heavy formats with other active learning teaching strategies, which includes problem-based learning, team-based learning, flipped classroom, peer-assisted learning, micro-learning, and gamifications. And they have reported remarkable gains in the form of student learning experiences and performances, if you look in the literature and find the evidence related to it. However, we cannot simply remove lectures without replacing them with a structured evidence-based alternative, and this is where team-based learning becomes highly relevant. So any one of you can tell me, what do you understand by team-based learning?
Excuse me, I'm Dr. Nermeen Nosser. Can I
Yeah.
ask you something before answering this question? When you are talking about the lecture, I think you mean traditional lecture, but
Yes.
instead of replacing the lectures by something, why can't we just improve our performance in the lecture to turn it to be an active lecture, to use flipped classroom? And we have so many strategies that can be used to make our lecture not traditional, to make it maybe a part of the active learning.
Yeah, thank you so much, Ms. Nermeen, for highlighting this
May
point. This
excuse me, may I interrupt? Team-based learning, as we have been, I think, holding, is that the facilitator comes in, gives a scenario and a little bit of insight, and then he gives out the material about the subject and the topic. The students break down into groups of 3 to 5 or 6. They among themselves they interact for 20 minutes or so, and then the facilitators ask them to give their point of view, and then the whole group, as a class of probably 50 or 60, they may interact and give an insight into the topic. That is what my
Thank you.
impression about
Yes.
team-based learning is.
Thank you so much, sir. Thank you so much, sir, for your input. And Ms. Nermeen, thank you for raising this question. Actually, being an educator, we are all familiar with this fact that in today's world, knowledge is everywhere. And especially with the AI, things have become more accessible for the students. So today's student does not require to be spoon feed. What they need is that how actively and meaningfully they can engage in the learning process. And this is what we need to learn, that how we can make our lectures to be more interactive and the more satisfaction for the students, so that the learning becomes meaningful for them. And it's not like that that you need the lecture format completely remove that and obsolete that. No, but you can modify your lectures by involving the interactive strategies in your lecture system. I hope you understand my point, Ms. Narmeen.
Yeah, thank you. Thank you so much for the
Thank
clarification.
you. Yes, because this is what you're going to learn, that how you can how you can basically implement team-based learning in the large class format. Okay. So here is the best definition I found in the literature related to team-based learning. Team-based learning is an active learning and small group instruction strategy that provides students with opportunities to apply conceptual knowledge through a sequence of activities that includes individual work, teamwork, and immediate feedback. So what are you understanding from this thing? That TBL is an evidence-based, collaborative, and instructor-led learning approach designed to engage large classes in meaningful way, as TBL provides an opportunity to continue teaching in a manner that engage large number of students in a structured sequence of activities that enables them to engage themselves in a small group interactions, get immediate feedback, and do decision making. So this is a structured sequence of sequence format of PBL, which provides opportunities to the students to apply and build conceptual knowledge by passing through a series of steps involving preparation and readiness assurance process and application of knowledge through clinical problem solving activities. So if I talk about the history, little bit history about TBL and how it has actually originated, it was basically given by Larry Michelson in 1970 when he was teaching marketing at the University of Oklahoma. His class size increased and he wanted to find ways to make the class more engaging and interesting for the audience. Later in 2001, the US Department of Education provided funding to Baylor College of Medicine in Texas to promote the use of PBL in health professional education. This initiative supported faculty development workshops and I would say symposias and educational scholarship, which as a result gives boom to the adoption of PBL across various institutes, including medical, dental, allied health sciences, not only in United States but international level as well. And if I mention the two notable examples of the institutes which have changed their curriculum from traditional lecture-based curriculum to total. I would not say that total, but maximum to lecture-free curriculum. Two names coming to my mind. The one is the Bonshot School of Medicine at Wright State University, and the other one is Tehran University of the Medical Sciences. And they have given a remarkable results in the form of improvement in the overall performances of the students and the learning outcomes. So why do we use PBL? what's the benefit we get by using the PBL? If you go into the literature and you see that recent systematic reviews provided an evidence that TBL enhances positive outcomes in terms of student experience and academic achievement. And the interactive nature of TBL encourages students to communicate, to develop their communication and collaboration skills, providing a valuable learning experiences. And the most important, the TBL method allows a single instructor to conduct multiple small groups simultaneously in the same classroom. The problem, the challenge we commonly encountered in problem-based learning, which is basically overcoming by this team-based learning. It appears to be cost-effective and feasible instructional strategy. So it can easily be implemented by the institutes who actually face resource challenges in the form of workforce, financial and logistics. They can easily use their certificate TBL to improve the overall learning outcomes of their students. And moreover, in the TBL process, the students remain motivated to involve in the pre-reading exercises because they held accountable for their individual and group work activities. Another study demonstrate that TBL equally effective active learning approach, especially helpful for lower academic performers and as compared to high academic performers, and improve their overall learning experiences. And addition to that, I would say that in the TBL process, students are actively involved in discussing the clinical scenarios, the problems given in the form of a clinical scenarios as a team. They're involved in the discussions and the collaborations. They do the critical thinking, problem solving. So overall, their deeper understanding of the subject matter enhances and it leads to the retention of knowledge. So let's now walk through the basic architecture of the team-based learning process. And the team-based learning process basically revolves around three phases. And as I'm going to walk through these three phases, you'll come to know that this is structured instructional strategy rather than simple teaching technique that enables students to pass through a sequence format of series that helps them to build on conceptual knowledge that they're going to apply in the application phase, in the application process, in the third phase of the team-based learning process. So the first phase involved is the preparation phase, in which the learners basically study an advanced assignment provided by the faculty. Then we have readiness assurance tests, where the learners demonstrate knowledge through individual and group readiness assurance tests in the form of IRAT and TRAT. And then And then we have the third phase, which is application of knowledge, where the learners apply course concept to clinical problem solving exercises designed by the faculty. So now, let's discuss these phases in detail. And before discussing that, you need to remember that various disciplines across the globe have adopted TBL in a variety of combination. And because of the variations in the way the TBL is delivered within health professional education, we're going to use Headed and colleagues 2012 developed standardized framework. So it is very important to remember that before implementing the TBL, making an integral part of your curriculum, it is important to orient the students regarding TBL, its format, how it is different from other small group teaching strategies, okay, what they are expected to do in it, and how they're going to participate in it. So there are various ways you can orient the students, but in the literature, the most relevant way is to give the students this article, 3 Keys to Using Learning Groups Effectively by Michelson 1998. Give them to read this article in the class, then form the teams, give them IRAT and TRAT test on TBL from the article, and end with a couple of application questions about TBL. After the orientation, in this way, the students understand the basic relevance of this team-based learning and what they're expected to do. They are clear about this thing. In this way, you are, maintain their encouragement and the motivation regarding the session. So in the phase 1, as I mentioned earlier, Phase 1 is related to preparatory phase. It is occur outside the class. During this way, the students studied the pre-reading material given by the facilitator in the form of learning objectives, lectures, tutorials, videos, labs, articles that you want students to learn related to that TBL session. And this format, this pre-reading material basically support the concept of flipped classroom. I hope you have idea of flipped classroom. So in the same way, during the TBL, in the first phase, you provide all the reading material to the students so that they prepare outside the class. Then we have the second phase, which is related to readiness assurance process, which involves IRAT and TRAT. This process basically occurs inside the classroom. In the IRAT stage, each individual student completes a set of MCQs consist of 10 to 20 MCQs, single best type of MCQs that focus on the concepts they need to master in order to be able to solve the team application problems. After individual readiness test, the student disperse into the teams, and then they solve the same set of MCQs in the form of a team, which they have solved individually. So while making the teams, it is important. The teams which is formed for the TBL are not created randomly. They are very carefully designed to ensure diversity in the team, and usually the team is comprised of 5 to 7 students. And it is important that in the teams which are developed initially, the same teams remain at the end of the course, so that they develop their trust, they communicate effectively, and they learn from each other qualities betterly. So in the team readiness assurance test, as I mentioned earlier, the same set of questions which each students solved individually, they're going to solve it in the team through a consensus building discussion. And after that, all the teams display their answers simultaneously at the same time. So displaying the result of a TRAT simultaneously, you can use different customized formats. You can use develop your own table in which all the teams add their answers, and you can compare those answers with the model paper, or you can even use the display card method, or you can use the scratch card method. You can use the clickers as well. But if you look into the literature, you're going to find that the most relevant way is to use a scratch card method. And you can find the detail of the scratch card method on easily on the website, which is Epstein Educational Enterprises website. So because when you use the scratch card, it is easy to grade the students according to their performance individually and in the form of a team. So the third phase, after they perform in the team and they solve the 10 to 20 MCQs based on single best type of MCQs, the third phase is the team application phase, which is the most crucial step of team-based learning. Students in teams get presented with a problem which is related to real clinical scenarios which students going to encounter in the future. Here they are challenged to do analysis, interpretation, synthesis of information, and make a specific choice from the given available options based on their clinical reasoning and decision, and report their specific choices simultaneously with other teams. In this way, they explain and defend their choice if they're asked to do so. And here you can see there is an appeal system as well. The teams can submit the written appeal out of the class if they feel question is poorly structured or misleading, or if they can defend an alternative best answer with references. And there is the most important a step in the TBL is a peer evaluation, which is occurring throughout and at the end of the session, which is also occur at the end of the session. Mostly in this, we get the students involved in the constructive feedback mechanism, giving both quantitative and qualitative feedback, not only on their performance, but also on the performance and contributions of their team members related to the activities. In this way, they learn the skill of giving constructive feedback to their to their teamwork, to their team, to their peers, which is an essential skill, which we expect from the student in health professional education.
Dr. Sana,
So
please,
yes.
thank you very much. But many were asking if you can slow down a little bit, and we have question for you.
Okay.
When
Okay.
can we start a question whenever you can? Just let me know, because some of the participants having question need to be answered.
Okay, let me finish this cycle, then we have a question. Let me
Okay.
explain this yes format.
So can you
So
slow a little bit, please? Okay.
okay.
Thank
Okay,
you.
the final score of the TBL is based on two aspects: that how well a student has contributed to the team and how effectively they provide feedback to others. And this is one of the example I have taken it from the AIME guide number 65, and they have given the distribution that how you can, grade the students' performance according to their contribution and their evaluation. So but it depends upon your requirement and the content, that how you want to grade the student, and also depend upon the weightage according to your assessment policy, that how much you want to give the weightage to the students in the TBL process. So those steps that which I have presented you previously is related to the students, that what you expect student to do during the TBL session. And here it is important, being an educator and being an instructor, you should be familiar that during the development of PBL, what format you need to follow. This is also, I have taken this image from the literature. And while creating the TBL, it is important by the faculty to follow the backward order on how students experience it. While students follow a forward-thinking trajectory, if you look at here, this is a forward-thinking process in which students build on their concept by following through certain steps and certain processes. And here, the faculty need to follow backward design by focusing on outcome-based approach to stay focused on what students ultimately able to do throughout the session, what you expect them to to perform during the TBL session. And that's why you need to follow a backward design. First, you need to define your learning goals, your learning objectives, what you want students to learn during this TBL course, and then you design the team application exercises in the form of a clinical scenarios. So clinical scenario, and while developing this clinical scenario, you need to remember this 4S framework. This is the 4S framework, okay, which is significant problem, same problem, specific choice, and simultaneous report. Significant problem, that the problem you are giving to the students in the form of a clinical scenario should be relevant and authentic. The same, all the teams would work on the same problem, and the teams choose a specific choice based on their reasoning and decision, and all the teams simultaneously present their specific choice. So while developing the clinical scenarios, you follow the 4S framework or principle, you can say that. And after that, and what is the reason behind developing this team application scenario is that designing this first ensures that all the subsequent materials are relevant to the final application. And after this, you develop the exercises related to IRAT and TRAT. And here you need to remember, as an educator, you need to remember two things. Your first is that you need to develop two sets of MCQs. First set is related to single best type of MCQs, with student going to solve in IR and TRAT process, and it is developed up to the level of understanding. So, because here you need to evaluate their basic understanding of the concept that they need to master in order to apply that knowledge in team application problem solving exercises. Okay, and then in the tab, team application exercises. In here, you need to provide 3 to 5 extended matching questions with multiple options. And as you all know, that EMQs are developed by higher cognitive orders of the Bloom's taxonomy. So they should include EMQs from the C3 to C5 level. So after developing these 2 sets of MCQs, you design and prepare your pre-reading materials for the students and so that you can give the advanced assignment for them to study for the TPL sessions, that you make it effective and fruitful for them. So up till now, if you have any questions, kindly let me know, because I've given you the both perspective from the student and from the teacher side.
So we have the first question was, can all large group instructional sessions be converted to TPL?
Or no, it's not necessary that you need to convert all large group of teaching strategies to TBL. It depends upon your content, and it depends upon the requirement of your curriculum and the feasibility that how much TBL can be beneficial for the students. Like if you talk about the preclinical years, and in the preclinical years, you have multiple other options as well, that if you conducting active teaching strategies in the form of PBL and flipped classroom. So few of the content you can implement, especially in the foundational basic sciences subjects. You can implement this TBL strategy to improve and enhance the overall motivation among the students, so that they can, feel appreciated and accountable for being involved, for pulling the activities along with the teams and contribute their understanding, and so that they can be given immediate feedback and they can be rewarded accordingly in the form of grades.
Okay, so we have another question. Can CPL and TPL replace lecture in clinical teaching?
No. Okay. Team-based learning, mostly in the literature, it is written that mostly it is implemented in the preclinical years. As I said earlier, mostly it is feasible for the foundational years, where you give the basic concepts of basic medical and dental sciences. And there is less evidence available and still growing in the literature related to its implementation in the clinical years. But there is no hard and fast rule. You can also implement TBL in the clerkships as well if it is developed properly.
So we have a question on the TRAT. Which is better in TRAT, to give feedback on each question or after they answer all the questions? Also, what is the best format of phase 3, which is application?
Okay. In the TRAT, the instruction give a clarification view, which is a feedback. It's not like a detailed feedback you have to give to the students. You only give clarification on the concepts which you feel students have been struggling during the TRAT process. So it's not like a detailed lecture. It's just to the point, which the instructor during the TRAT activity, he felt that students have a disagreement, or he has felt a certain kind of struggling, and they have been this content seemed to be challenging for the students. So on that particular content or that particular context, the instructor can give the feedback.
Okay, so there is discussion about the TPL and CPL. We have a question regarding the difference between TPL and CPL, and is if the MSQ in TPL replaces text dilatation in CPL. This is the question, but I actually didn't get.
Okay. Actually, both of the teaching strategies are student-centered teaching strategies, but there is a massive difference between problem-based learning and team-based learning, because as I mentioned earlier, that PBL is the most widely used inquiry-based teaching strategies amongst various medical schools around the world, and the evidence related to team-based learning is still evolving and still growing. And the basic difference between a PBL is that PBL is basically usually conducted in a small groups, and you need more workforce to implement that PBL. And in the PBL, as the name indicates, learning is initiated by a problem which is given to the students in the form of a trigger, and the student take the ownership of their own learning. They identify their own learning needs. You are not providing anything to the students. People, identify their own learning objectives, and they devise all the study material which is required to solve that particular problem. But in TBL, it is not only student-centered but also instructor-led teaching strategy, and it is conducted in the large class format, and then you convert that large class format into small teams. In this way, one instructor can lead multiple small group of students, and teach them in the large class format. And these small group of students can involve an interactive and engaging in collaborative activities during team-based learning.
So thank you very much, Dr. Sana. So I can resume your presentation because only we have 10 minutes for you.
Yeah, but I'm about to end.
Yeah,
I'm about to end.
very much. Okay,
Thank
thank
you.
you very much. Go on.
So, every strategy has its own pros and cons, and definitely we have certain challenges in team-based learning as well. And one of the biggest challenge, I would say, is the time intensive. TBL is time intensive in a way that it requires a careful planning across multiple steps, defining outcomes, designing activities, developing assessments, and preparation of the materials, and also collaborating among faculty with different expertise, and vetting the preparatory material that you need to give to the students, right? And again, then we need to train the faculty, because we need training in both the TBL design and facilitation, ensuring consistency and standardization in delivery of the TBL. And definitely, we require disciplined and well-organized facilitator, because strict adherence to structured sequence within limited class time requires strong facilitation skills. So we really need to have a well-organized facilitator for this. And you may encounter student resistance in the form of perceived workload in the TBL process, like when you give advanced assignment and you ask them to prepare the material. So it is very important. The students should buy in the process of TBL, and they should be encouraged and motivated by giving them the constant and immediate feedback on their performances and their contributions in the activities involved in team-based learning. And then definitely this cannot be done without the institutional support in the adoption of TBL, because you need the logistics, you need the resources for its implementation, and we definitely need faculty free time for its design and its implementation. So these are the few references I have taken the content from. And thank you so much, everyone, for your patience listening. Any questions?
Thank you very much, Dr. Sana. I think we have one question also: how to make good team?
How to tame good team. Okay. So as I mentioned earlier, teams are not randomly created. They are designed very carefully while ensuring the diversity in the team. Like in a team, you should have students with who are high achievers. You can make team with the lower achievers. This kind of in this way, you have a mixed group of students based on their background, they based on their characteristics, they based on their experiences, so that you can have so each student get benefited from each other, good skills.
So we have another discussion regarding the TPL should be used with summative assessment, could be conducted without counting its mark. Yani, consider it better to be summative or formative.
Yes, the marks you grading you give during the TPL session included both in the formative and the summative as well, but mostly it is included in the summative grading.
So how to perform peer evaluation and how to consider it the part of summative assessment in your opinion?
Peer evaluation is one of the pertinent skill with students develop during the team-based learning, in which the students basically learn how to give the constructive feedback based on both quantitative and qualitatively, and the instructor basically evaluate that how you have given that feedback to your peers and give you a minimal percentage while grading the overall performance of TBL.
Okay, thank you, Dr. Ikram Sana. Do we have any more question for Dr. Sana before we close that part of the session? Okay. They are asking for the reference, so can you show up the slide with the reference, please, Dr. Sana?
Reference slide?
Yeah.
Yeah.
Okay. Okay. I think we don't have any more question. Thank you very much, Dr. Sana, for your effort and time.
Thank you so much for inviting me. It was a great pleasure to conduct this session. And thank you, all of you, for your patience listening.
It's great pleasure to have you with us. Can you please stop the share?
Okay, thank you.
Okay. So now we are going to have our talk with Dr. Ahmed Al Arabi. Okay, Dr. Ahmed.
تمام يا دكتورة، مع حضرتك لحظة.
Can you share, please? So, Dr. Ahmed is a demonstrator of Medical Education Department, Faculty of Medicine, Mansoura University. He is going to have his second talk with us. Okay, Dr. Ahmed, the floor is yours.
مساء الخير يا دكاترة، الأخبار؟
Dr.
أتمنى
Ahmed,
تكون الشاشة ظاهرة عند حضراتكم.
هي ظاهرة, but can you please يعني in English because we have foreigner speakers, please.
تمام أنا فاهم. Good afternoon everyone. Thank you for joining today's journal club. I am Dr. Ahmed Al Arabi, demonstrator of medical education at Faculty of Medicine, Mansoura University. I am also a Master of Science candidate at Faculty of Medicine, Suez Canal University, and an ISME member. Today I am presenting a landmark paper from Academic Medicine Journal. Today I am presenting a landmark paper from this journal, Academic Medicine, which is a very reputable journal. And this paper exactly has been cited over 600 times. This paper has been published in 2010 by Dr. Paul Coles and his colleagues, titled The Impact of Team-Based Learning on Medical Students' Academic Performance. This is one of the first studies to give objective evidence that TBL actually improves exam performance and that weaker students, academically of course, may benefit the most, more than higher performing students even. I'm going to proceed with the Arabic language first and then change to the English for non-Arabic speakers. مساء الخير على الحضور الكرام. زي ما وضحت لحضراتكم كده ان الورقه البحثيه بتتكلم عن تاثير التي بي ال على الاداء الاكاديمي للطلاب، والورقه البحثيه دي نشرت سنه 2010 عن طريق دكتور بول كولز في جريده الأكاديميك ميديسن. In our abstract, as we can see, the purpose or the questions that the research paper is going to ask. The first question, does TBL affect exam performance? The question, does TBL help lower performing students more? The method they used is retrospective analysis of 28 comprehensive course examinations over 2 academic years, from 2003 to 2005. Over 2 academic years, as I said, 178 second-year medical students, comparison of scores on pathology-based exam questions that were related to TBL modules versus the TBL unrelated ones. The results they reached that mean scores were 5.9% higher on TBL related questions. Lowest quartile students gained 7.9% versus 3.8% for highest quartile. So according to p-value, as we see in both results, they actually proven significant interaction. The conclusion, TBL enhances mastery of course content and academically weaker students may benefit the most. ده برضو I'm going to proceed in Arabic and then continue. زي ما وضحت لحضراتكم كده في الملخص السريع ده للرسالة، البحث غرضه هو الإجابة على سؤالين: هل التي بي ال بيحسن الأداء الأكاديمي؟ وده طبعا هيتضح في درجات الطلبة. والسؤال الثاني: هل التي بي ال بيساعد الطلبة الضعف أكاديميا، يعني اللي درجاتهم كانت أسوأ عن الطلبة اللي درجاتهم أفضل، أو الطلبة الشاطرين يعني؟ الطريقة اللي استخدموها عملوا ريتروسبكتيف أناليسيز ل 28 كورس إكزام، زي 28 امتحان تحريري شامل بيبقى فيه نهاية المقررات اللي بيدرسوها في سنة تانية. البحث ده دار على مدار سنتين، الباتش بتاعت 2003 2004 و2004 2005. فكان مجموع الطلبة في الدفعتين 178 طالب، ولما قارنا النتائج اتضح ان فرق المين ديفرنس يعني ما بين درجاتهم في الباثولوجي تي بي ال ريليتد كويستشنز للباثولوجي ان ريليتد او للتي بي ال ان ريليتد باثولوجي كويستشنز كان الفرق جوهري 5.9%، بمعنى ان هم جابوا درجات اعلى في الاسئله اللي كانت درست بطريقه التي بي ال بنسبه اكبر ب 5.9% عن اجاباتهم الصحيحه في الاسئله التي لم تدرس بنفس الطريقه. وفي نفس الوقت ان الطلبه لما قسمناهم الى lowest quartile and highest quartile، كان الربع الادنى من الطلبه اخر 45 طالب سجلوا زي درجات اعلى في التي بي ال ريليتد كويستشنز.
دكتور احمد excuse me دكتور احمد.
اتفضل يا دكتور.
I'm Prof. Asma. Sorry, Prof. Dr. Ahmed, kindly keep a conversation in English because we have many non-Arabic speakers.
Understand. I
Okay.
am okay.
Okay. Better يعني instead of using Arabic. Okay.
تمام. As we can see here, the dilemma, the authors frame a real problem, as Dr. Sana illustrated in her presentation, which is biomedical knowledge expands greatly, but faculty contact hours are fixed. We can't just add lectures from out of nowhere. I mean that timetable or weekly timetable is fixed, but the knowledge is expanding. So educators are moving from passive lectures to active learning. TBL actually introduced in 2001, and TBL uses a structured sequence in 3 phases, as we discussed before: preparation, advanced assignment, readiness assurance, either individual readiness assurance or group or team readiness assurance test. And the third phase is application exercise, which is real clinical problem solving. The gap in evidence: few studies had correlated TBL with objective exam performance. Some earlier studies actually showed reduced failure rates, but no clear performance gains. These are the questions, as we said. Methodology: retrospective cohort study. And I mean by retrospective cohort that exposure and effect happened in the past. The setting of this study is Boone Choft School of Medicine, Wright State University at USA. Participants 178 students from classes of 2006 and 2007, 86 males and 92 females. All students who completed all comprehensive course examinations included in the study. 2 consecutive academic years, I said, deemed exempt by institutional review board. The teams of TBL modules were 5-7 students each, randomly formed at the start of the year and kept intact across the courses. TBL modules were 35 in total across the 2 years. Each included advanced assignment to IRAT to TRAT to application exercise, TBL sessions. Each session was 2 hours, 40 minutes for the RAT tests and 80 minutes for application. Faculty facilitators, content expert plus second facilitator, grades. And this point is actually important because TBL in each course accounted for 15% of course grade. But the comprehensive course examination or the final exams accounted for 95% of the course grade, which means that the results are not accounted for student preparation more as this TBL is going to contribute to a high percent of their grade. But actually the reverse has happened, that the final exam grade would had 95% of the total final score. As we can see in this table 1, in term 1 of the second academic year, they had 4 courses: pathobiology and therapeutic, neuroscience, blood, musculoskeletal, and skin. And term 2, they had 6 courses. So in total number 10 courses across second year. But for 2 consecutive academic years, 2003, 2003, 2004, 2004, and 2005. In the right column, we are gonna see the topics in each TBL module. We have here 35 TBL module, and I mean 35 TBL session. Each session was 2 hours, as I said, with fixed teams across the academic year. Our outcome that we are measuring is performance on pathology-based questions from the 28 comprehensive course examinations. Why pathology? Why they selected pathology? 2 authors had content expertise in pathology, allowing accurate classification. Classification of questions was blinded to student performance, TBL related and TBL unrelated. Statistical analysis, they used paired t-tests to compare mean scores on team-based learning related versus TBL unrelated, overall score and the score by term, to weigh ANOVA to compare the difference between highest and lowest academic quartiles. They also reported the discrimination indices and the difficulty values to ensure question quality was similar. Before we proceed, I need you to answer my first question in the critical appraisal, so we not oversight any point. Yeah. I need you, مثلا, to tell me, was there a clear statement of the aims of the research? Anyone? Can you hear me?
Yes, we hear you, Dr. Ahmed. Go ahead. You are asking
Okay.
about the aim of the research?
Yes, this is the
Okay.
first question. I need you to be more interactive with me, please. I
I
actually
encourage,
illustrated this point.
yeah, I encourage all participants to cooperate with Dr. Ahmed in regard to his question about the study he is now presenting.
Ahmed, please can you bring the aim again, the slide of the aim again in front of the participant because you move, yeah.
From this slide, can anyone tell me what are the aims of the research? Or are they clear to you?
Oh, yes, Dr. Asma say yes. Clear aim.
Nicely, nice. Then what are the questions the study is asking about?
And Dr. Rizwana say yes, okay. So they agree that it's clear.
Okay.
Okay.
Can I ask you another? I can't see the chat of the meeting.
We are following the chat, don't worry. Yeah,
Oh.
following the chat, yeah. So you have two participants saying yes, it's clear.
Okay, can I ask you another question? Do you think that research design they had is appropriate to address these aims that are clear? I mean, what research design they used, firstly? Was it cross-sectional? Was it case control? Was it randomized controlled trial? What was the study design they used? And do you think it is appropriate to address the aims that we
Retrospective, so the cohort retrospective study.
Yes, retrospective cohort.
Yeah.
But they actually used another one modification to this design to overcome the confounding variables. And actually,
yeah. Can you clarify what you want to need or what you need to approach, Dr. Ahmed?
okay, I'm needing to approach that the retrospective cohort they used was within each student comparison. He compared the test scores or the TBL-related question scores within the same student. His correct answers in TBL-related questions minus his correct answers in TBL unrelated questions. So this actually overcomes the confounding variable.
Okay.
Controls even حتى confounders such as IQ, prior knowledge, and study habits. This design directly answers both research questions. As you can see here, total pathology-based questions analyzed were 705, representing 26.4% of all comprehensive course examination questions. TBL related were 243 questions, TBL unrelated 462. All 178 students got TR mean score 83.6%, TU, T unrelated, mean score 77.7%. So the difference was plus 5.9. Results were consistent across term 1 and term 2. Note 5.10% improvement is statistically significant, as the authors argue. Educationally meaningful, it represents about 1 letter grade step in many grading systems. By paired t-test, the p-value actually was less than 0.001, which means that TBL actually has a significant, statistically significant significance in improving the academic performance of the students. Here is a more illustration of the results I said before. Lowest academic quartile, 45 students, got a 77.5% score in TBL-related questions and 69.6% in TBL unrelated. The difference was plus 7.9, while highest academic quartile, the highest 45 students, TR score 89.3, T unrelated score 85.5%. So the difference in the lowest academic quartile was higher than the highest academic quartile. This is a key finding. It suggests TBL may be particularly effective for students who are struggling, possibly due to peer teaching and accountability, or even because the lowest academic quartile have more knowledge gaps than higher ones. Discussion? Why did TBL improve performance? Authors discussed that this may be due to preparation to advanced preparation. IRAT motivates thorough study of advanced assignment, or peer teaching, teammates explain reasoning to each other, or the immediate feedback, faculty staff members clarify concepts where teams struggled, application, where teams wrestle with realistic problems, which deepens understanding, or even social accountability. Students are motivated to prepare to contribute to their teams. Why do lower quartile students benefit more? As we said, maybe due to peer expectations of their colleagues to prepare well, maybe due to knowledge gaps, so peer teaching yields large absolute gains. The authors also discussed the limitations. Note 5 limitations is that content is limited to pathology. We in this study compared the scores of pathology-based questions only. So the results may be not generalized to all disciplines. Active learning effect, which is the second limitation. Any active learning method might produce similar results. The third limitation, single person classification. Actually, he was blinded to student academic performance, but Dr. Paul Coles is a pathology professor. So maybe he got a potential bias in categorizing the questions to TBL related and TBL unrelated. The fourth limitation that they excluded 80 students out of 186 students of consecutive academic years, and they represent 4.3% of total students. 5 of them failed, which may bias the quartile comparison, and they actually said it in the paper. They did not hide this fourth limitation that they excluded 80 students. Short-term measurement exams were within 4 weeks. Long-term retention not assessed. Exams were after the module in the comprehensive course examination directly, so long-term retention was not assessed. The final conclusion, TBL significantly improves exam performance compared to traditional learning. Lower performing students benefit the most. And mechanisms preparation helps in improving our academic performance, of course. Peer teaching, accountability, these mechanisms align with active learning theory. This study sets a high standard for educational research. Now we are going to proceed with our critical appraisal. We have answered 2 questions already. The first question, was there a clear statement of the aims of the research? And 2 of you told me yes, there was a clear statement of the aims. Is a qualitative methodology appropriate? And no, it is not appropriate, of course. As we said, the study design here is retrospective cohort. Now, the third question we also answered, was the research design appropriate to address the aims of the research? You told me the study design was retrospective cohort, and I illustrated that they added a modification to retrospective cohort analysis, which is analysis within same student, within same subject, his scores compared to himself. So I need to ask you the fourth question. Was the recruitment strategy appropriate to the aims of the research? Are you following me?
No question. Thank you, Dr. Ahmed. Excellent presentation, mashallah. Everything is clear.
Thank you, Dr. Asma. I just can't see the chat of the meeting or any reactions, so I need
No
to ask
questions in
you.
the chat. No
Thank
questions.
you.
They
Thank
are
you.
thanking you for your excellent presentation. Do you have any more questions from your side for our audience today?
Yes, I'm going to continue the checklist. Was the data collected in a way that addressed the research issue? Firstly, I need to answer the question 4. Was the recruitment strategy appropriate to the aims? Yes, they included all second-year medical students, as I said, from 2 consecutive years, 178 out of 186. So 95.7%. This high participation rate minimizes the selection bias. They explained why only complete data were included. Why complete data were included? As I need the exam scores to be evident, to be present, to actually include it in the statistical analysis. So the recruitment strategy was appropriate to the aims. Yes, it was appropriate to the aims. And I got all second-year medical students. So high participation minimizes selection bias, as I said. Right. Fifth question, was the data collected in a way that addressed the research issue? Anyone want to answer this question? Was the data collected in a way that addressed the research issue? We actually answered the question targeting the recruitment strategy, how I recruited my participants or my sample. But the data itself collected in a way that addressed the research issue. Anyone? What are the data in our study that they gathered? They actually gathered the objective exam scores. Objective because they were MCQ questions. Objective exam scores are a quantitative data they collected with a blinded classification of questions, as I said, by content experts. So the content expert didn't know the student performance was good in these exams or was bad. He blindly classified the questions as a content expert, and a large number of questions, as I said, 705 pathology-based questions, which strengthened the validity, of course. So the data collected in a way that addressed the research issue, yes. The sixth question, has the relationship between researcher and the participants been adequately considered? Anyone want to answer the question? The relationship between researcher and participants? Actually, this question is related more to qualitative studies, but we can answer it here, Bordo. Partially, يعني, the relationship adequately considered partially. Why partially? Because the authors acknowledge in the limitations that a single person classified the questions, which could introduce bias. And by the way, the same person, Dr. Coles, he already have created 50% of TBL questions in the first place. So this relationship partially, and there is no explicit reflexivity statement. Let us proceed. As we said, clearly stated. Qualitative methodology wrong. Research design good. Retrospective within student comparison. Recruitment strategy appropriate, yes. Data collected in a way, yes. Relationship was partially addressed. Now the seventh question, have ethical issues been taken into consideration? Yes, they got the IRB, Institutional Review Board approval. Data were anonymized, and they transparently even reported that they excluded 80 students, which is a good ethical point. Eighth question, was the data analysis sufficiently rigorous? The statistical analysis that they did, was it sufficiently rigorous? Of course, it was sufficiently rigorous. I know that you maybe didn't read the study well, but from the tables I showed you before, they did, and they used paired t-test for overall comparison, and they used two-way ANOVA to test the interaction between quartile and the question type. They also reported the discrimination indices and the difficulty values to ensure question quality that was similar between the TBL related and the TBL unrelated. So discrimination and the difficulty indices, they teach us that the quality of the questions are approximate to each other, I mean. Ninth question, is there a clear statement of findings? And what were the findings of the study? Yes, findings are explicit. Actually, explicit, very explicit. Mean scores were 5.9% higher on TBL-related questions, and the lowest quartile, as I said, gained more than the highest quartile. Lowest quartile gained 7%, while the highest quartile gained 3.8% with a significant interaction. P-value in two-way ANOVA equals 0.001. This directly answers the research questions. Finally, how valuable is the research, and will the results help locally? The research is very valuable, of course. This is the first study showing that TBL provides a larger benefit for lower performing students. It provides objective evidence that TBL enhances mastery of course content. And I said that authors also identify the need for future research on long-term retention. I mentioned in limitations that short-term retention only measured because the comprehensive course examinations actually held after the course exactly. And I mean by exactly after 4 weeks from beginning of the TBL module. Comparisons with other active learning methods. Maybe the results due to active learning in general, not due to BL specifically. These findings are transferable to our context, I think, at Mansoura, especially as we expand active learning strategies. That concludes the critical appraisal. As you can see, the study is methodologically strong with clear answers to all questions. Finally, thank you to the Journal Club organizers, and thank you to all of you. I am happy to continue discussion. And if anyone got any question, please proceed.
Thank you, Dr. Ahmed, for your nice presentation and actually for choosing this interesting article. I don't know if I'm missing something. Did you upload this article before the time of the meeting?
Yes, Dr. Nermin, we did that through the organizing team. We uploading the articles in different communication means of the journal club.
Oh, okay. Maybe I missed it because, when we have time to read it before joining the meeting, it will really increase the
Interaction.
yes, the activity and yes, the
We always
relation.
aim to that, Prof. Nermin, we always aim to that as a ISME
Yeah,
Journal Club organizers. Prof. Hind, she is the moderator of the today's session, and she is sharing all articles about this session through different means. We always use
yeah.
ISME WhatsApp group, and also we share this through our official email. If you are registering, so we send it to all people who are registering 1 month ago on this
Uh,
session.
Okay, maybe you will encourage me, yes, to join and to register. So
Inshallah.
I will be able to see all these activities. And actually, I'm really very happy about this. It's really interesting. And thank you for the organization. Thank you for the presenters. Thank you, Yani. I thank them very much for their comprehensive presentation. Thank you so much.
Thank you, Prof. Nermin. And you are welcome always with us. Thank you.
Okay.
The floor for you, Prof. Hind.
Thank you, Ahmed, for your presentation. But we have only one question from Dr. Dua. She was asking, while you are discussing the methodology, you mentioned that there is a relationship between the participant and the researcher. So she had her inquiry how this come through because it is a retrospective study. Can you explain something like this?
I mean by the relationship between the researcher and the participants, not the participants directly, but the TBL modules that they had in their academic years. He is the head of the pathology department in Boonshoft Medical College. He made blinded classification of pathology-based questions, but on the first hand, he actually created 50% of the questions that they got their comprehensive course examinations on. And by this, I mean partially addressed the relationship between researcher and the participant.
Okay. So we have Professor Mustafa Abdel Nasser raising his hand. So do you have any question, Professor Mustafa? Okay. Okay, thank you.
No interaction from Prof. Mustafa. Prof. Hind.
Sorry, I am mute.
Okay, Prof.
Salam,
Go ahead.
salam alaikum.
Dr. Mustafa,
Thank
alaikum
you for
assalam
all
warahmatullahi.
presenter, Dr. Sana, Dr. Ahmed, Dr. Asma, Dr. Hind. I have just feedback or about TBL and BBL also, because I have an opinion or just a recommendation that still our staff and our students needs more orientations about these methods, especially each year, because some are still not convinced or have a resistance for this or have not have a true idea about the importance of this method. So it is our job for those who have a degrees or are specialists in medical education to do this job, because sometimes I feel that we are speaking to ourselves. This is my impression, and I hope we can do this job, everyone in his position. Thank you.
Thank you very much, Professor Mustafa. It seems that we have no more question for Dr. Ahmed. So finally, at the end of the session, I need to
No
thank
more
you.
question, Prof. And I need to thank you for this moderation of this excellent journal club. And also I need to thank all audience for their active participation. And thank Dr. Sana and Dr. Ahmed for their excellent work and excellent presentation. Thank you, Prof. And
Thank you,
Okay.
Doctor. Thank you, Dr. Asma. You are welcome.
You are welcome. Thank you all for your participation and being with us. We can extend our sincere appreciation for Dr. Sana and Dr. Ahmed for their valuable perspective and discussions. I hope this session were fruitful and add to knowledge to our knowledge. And thank you all. See you for the next run of our journal club. Thank you. Thanks, Dr. Asma and Dr. NG as well for your support and everything.